Every day between 12:30 and 1, we do a case study about one of our patients, and from that try to help you with some information so you can live pain-free. So our goal is to give you tools. We have a solution when no others exist, but we do this because doctors are not obligated to report their outcomes, so very often you don't know which therapies are best for your back problem, or you're sort of stuck in a pattern where you're not getting better and you don't know what to do. So we're here to help you. 33-year-old male, this is case study 175. We're up to over 1,000 case studies now. 33-year-old male, back pain, 3 years of back pain, not getting better. Had 3 years of back pain, not getting better, started to develop some sciatica, and actually pretty severe sciatica. So before this patient saw us, because they had the pain for 3 years, not getting better, wound up in the ER, which is not uncommon. You wake up one day and the pain's so bad you can't hardly handle it. End up in the office for the ER, not the office, but the emergency room. Had gone through several courses of physical therapy and not gotten any better. Had done 2 cortisone injections with no relief. Was taking narcotics, highly addictive. We've talked about that. Almost 20,000 people die every year from narcotics that are prescribed, not the unprescribed. And then was taking anti-inflammatories, non-steroidal anti-inflammatories, not getting any better. So we talk a lot about outcome and helping you make decisions. Well, in this case, these weren't working. So the outcomes for his condition was that these didn't work. That was the outcome. We have a 9-step process. Now today we're talking about the tools. When you come in, we give you a real thorough education about what sciatica is, because when you truly understand it, you make better decisions, and it's easier for you to understand exactly what we're trying to do. But through that process, we formulate a diagnosis about what's causing the pinching of the nerve. Sciatica is a pinching of the nerve as that nerve exits through the spine, typically through what's called the foramen. And then we formulate a treatment plan to solve your problem. And we have a 9-step process to solve your problem, but 2 of the steps are tools. Not necessarily anything we're doing to you, meaning we're not actually exercising you, but we're giving you tips about how to bend, how to twist. Yesterday we talked about how to get in and out of a car. We also talked about if you're sitting in a chair too long. One day we talked about brushing your teeth and how that might be making your back pain worse because you're leaning forward. So these are tools. When you understand what's making your back better or what's making your back worse, you avoid the activities that makes it worse. Okay? So that's one of the tools. But also when you get to the end of our care, we give you exercises that are specific for your problem. Not everybody's problem is the same. And some people need more stomach exercises. Some people need more back exercises. So we identify exactly what exercises you need. So patient came in to see us. We formulated a diagnosis, identified that he had a degenerated disc and stenosis. Okay, stenosis is, he was 33 years old, but stenosis is a wear and tear over time. So he'd had a lot of wear and tear. This is part of the degenerative cascade. He had 2 of the 5 causes of sciatica. We have a video on the 5 causes. He had 2 of the 5. Now sciatica is a pinching of the nerve as that nerve exits the spine and then goes down the leg. We've talked about that before. So he had these 3 things. Came in to see us. He had degenerated disc, which is where the disc physically gets smaller. Disc in between the vertebrae. When it degenerates, the vertebrae get closer together, and what happens is you start to pinch that nerve as that nerve exits directly off of the spinal cord, right through here. He was having some of that. Also had some stenosis, again, narrowing of the opening inside the spine and narrowing of the opening where the nerve comes out. Those are both called stenosis. When he came in to see us, we evaluated him. He had back pain and sciatica, and the pain on a scale of 0 to 10. 0 is no pain, 10 is severe pain. His pain was a 9, which is pretty high. It's about as high as you can get. 10 is the highest, and when he was in the ER, it was a 10. But he was taking the narcotics and the pain had come down to a 9, but still a lot of pain. The kind of pain that you can't take it anymore. His Oswestry Disability Index, and I don't want to talk about this too long because somebody said I'd talk about it too long, but the Oswestry Disability Index is a questionnaire that you as a patient fill out to identify how much effect the pain has on your ability to live your life. The higher the number, the less you're living. The lower the number, the closer you are to normal. 0, it's scored from 0 to 100. There are 5 categories. The 5th category is what we call bedbound. There's so much pain that you can barely get out of bed. So your level of disability is very, very high. And incrementally it gets a little smaller as we go down. But the one thing that we know is the longer you're above 40, the more likely you are a candidate for surgery. He was at 50. He was at 50, he had been for 3 years, so he knew he was a candidate for surgery. Came into our program, we treated him 29 times. And at the end of his therapy, his back pain was a 2, his sciatica was a 2, and his oswestry disability index was an 18. So we got him down below 20. Our goal is to get you down below 20. Okay? 20, anything below 20 is what we call minimal disability. You can live a normal life without any sort of hindrance or disability at all below a 20. Okay? Above 40, you're in bad shape. Even above 20 is rough. Okay? But he was pretty high. So at the end of it, he was down to an 18. So when you graduate therapy, we give you exercises that are specific for your movement patterns. Everybody has a body type with specific movement patterns, and not everybody's the same. So we gave him specific movement pattern exercises for him that were specific for him, and at the end of it, we called him a year later. We called him and said, how you doing? Back pain was a 0, sciatica was a 0, and his oswestry disability index was a 0. So what does that mean? It means when he graduated, he still had some pain and still had a little disability, but at the end of it, no more pain because he continued to do the simple exercises. They're not complicated. If they were complicated, you wouldn't do them. We don't give you complicated exercises. So what's the point of all this? If you have back pain, you have to get the proper diagnosis that matches the proper treatment. And then you need to make sure you're not doing anything that makes it worse, which is the tips. And we do the tips every Tuesday. And we do a lot of them. And we also give you tools about exercises for your body type and movement patterns. And by doing all those things, you can live the rest of your life without any back pain. That's the goal. Eliminate it so it doesn't come back. We treat the disc. What makes us different? Why did the patient go through all those therapies and not get any better? Because the problem is in the disc. Nobody treats the disc. We treat the disc by making the disc healthier. We take pressure off the disc. It doesn't hurt. We take pressure off the disc, and then we have you do exercises. We have you wear a harness. Do a little bit of unweighting. We call it unweighting. We're taking the weight off the disc, and then we have you do exercises. Combination of those two things solves problem. Nobody does this. Okay, physical therapy is just exercises. Chiropractic is just joints and sometimes exercises. Okay, the injections are anti-inflammatories into the joints or in and around the nerve root. Doesn't solve anything. Narcotics decrease the signal from the nerve to the brain. Doesn't solve any problem. Matter of fact, highly addictive. People end up dying every year as a result of that. Okay, we affect the disc. It's the evolution of back pain. This is all about the evolution of back pain. That's who we are. That's what we do. You need the tools. If nothing else, pay attention on Tuesdays because we do the videos on Tuesday for the tools. Okay, every once in a while we'll do the exercises, but the tips are really good and those are on Tuesday. So subscribe to our YouTube channel so you get more information.